Afterschool Alliance is hosting in partnership with the Forum for Youth Investment and the American Institutes for Research as part of their Readiness Projects initiative. If you weren't able to view the first two, don't worry. We are going to send you links to them after this webinar so that you can not only watch them, but share them. And we'll also be sending you a link from this webinar, which we are recording. And you are welcome to share that with colleagues, with friends, with anyone that you think may benefit from listening to this webinar. When we began planning this series, we knew it was important to reflect that we're in uniquely challenging times. Between the widespread social and economic, is that better on my voice, folks? Hope so. Between the widespread social and economic fallout of the pandemic and the social unrest following the murders of George Floyd and Breonna Taylor, we are all extremely worried and concerned about the effects and impacts of these times on our children and youth. In these series of webinars, our goal is to showcase why and how implementing trauma-informed care, particularly in the after-school space, is so important to healing and empowering the youth that we serve. We were very deliberate in choosing the title of the series. We believe that it's a critical time to take an asset-based approach to the challenges facing our youth. The definition of crisis, which you're about to see, reflects the situation in which we find ourselves, not just the challenges with which we are being confronted, but also the opportunities to move forward and improve the odds for all of our kids. As I mentioned, we have two, this is the third installment of our webinar series, and the first two webinars really provide a great foundation for this one that you're about to hear about. On Thursday, October 1st, we hosted our first webinar, and it focused on the why and how of implementing trauma-informed approaches in after-school programs. It provided an overview of what we know about the effects of adversity on child and adolescent brain development, with an eye towards why trauma-informed practices and developmental relationships in particular are so important. Our second webinar was on Tuesday, October 13th. And it focused on the practical implications of what it means to employ a trauma-informed lens in programs and to employ strategies that create genuine healing-centered environments that help mitigate the impact of and help youth recover from trauma. On that note, I am proud to turn this over to my co-moderator, Hal Smith from the National Urban League.
Thanks so much, Jodi, and thanks everybody for joining us this afternoon. My name is Hal Smith. I'm the Senior Vice President for Education, Youth Development, and Health with the National Urban League. We're excited by the panelists today and the continued focus on young people that these webinar series and all of our work represent. Our presenters and panelists for today are Chelsea Eickert, Children and Youth Master Plan Coordinator and Co-Coordinator of Trauma-Informed Community Network, RAISE, for the city of Alexandria, Virginia. Ayana Melvan, Senior Project Manager, Educational Initiatives and Lead for the Rhode Island Afterschool Network, United Way of Rhode Island. And Erik Peterson, Senior Vice President of Policy with the Afterschool Alliance. The panel discussion and Q&A will be moderated by Jodi and myself. Each presenter will provide a quick overview of their experience and work around trauma-informed care in policy, as well as highlight some of their key takeaways and recommendations for those of us working with young people. And with that, I will turn it to Erik to kick us off.
Thank you so much, Hal, and thank you again to the organizers and the opportunity to be part of this webinar and the series as well. So to start off, I was reflecting, listening to the first two webinars in the series on the research and evidence base and then the program practices, and was really struck how policy has not always been informed by the research base. And also it became apparent that policy, at least at the federal level, needs to catch up in many respects with the exciting innovative practices going on at the local level in programs. That said, at the federal level, it's sometimes going to be difficult to show direct impact of policies on young people and programs. However, there are a number of federal programs and federal funding streams that make local and state initiatives possible. They provide resources and support And that's really what I'm going to focus on in my several minutes here to get us started. I wanted to call out a few existing federal policies and programs that support trauma-informed care, particularly in the youth development space. And for those in the after-school field, many of these will be familiar, but hopefully some represent new opportunities. So catching up here to the slides, we'll start off with the federal COVID relief response. There have been a number of bills, but we're mostly going to focus on the CARES Act, which passed in late March, and which, while many of the funding has been obligated at this point, it's still at the local level and state level, flowing out to local programs, after school programs and school age programs. So a couple of these funding streams, the first one, the Childcare Development Block Grant, was about $3.5 billion. And we've tracked specifically about 14 states where after school and school age programs are using these funds. While these funds are mainly for programming itself, we have seen examples where states, particularly for the CCDBG funds, are using some of their funds to train staff in trauma-informed care and practices, and being able to incorporate some of those successful practices. On the education side, both the governor's Education Relief Fund, or GEAR, that you see on here, and ESSER, which is the Elementary and Secondary Education Relief Fund. Both of those, so at $3 billion and $13 billion, we've seen funds also go to after school and school age programs. In particular, on the education funds, social emotional support and mental health services were called out as allowable expenditures, as was after school and summer learning programs, thanks to the work of many advocates in the out of school time space. So while we know about total for those three funding streams, just under $580 million has gone to after school and summer programs, we know the need is substantially more than that. But the good news is that programs that are working with young people right now, whether virtually or in person in many cases with the CCDBG and GEAR funds during a virtual school day, and that are interacting with students as well as families that have experienced trauma, particularly the secondary effects of COVID. So around social isolation, around the abnormal circumstances that families and students find themselves in now, where they might have, for parents, job loss, housing loss, food insecurity, all of these that are factors that cause toxic stress or chronic stress. In addition to, of course, the disease itself, COVID-19, and loved ones and family that have been impacted by that directly. And so while these funds, again, don't meet the full need, they have been critical in providing those, allowing local programs and youth development practitioners, which we'll hear about, have heard about last webinar, and we'll hear about more at the local level, to be able to really work directly with young people and families. So we'll go beyond with the next slide, the COVID-related policies, and just talk about a couple others. Again, many of these will be familiar to folks on the line, but 21st Century Community Learning Centers, which is in centers, communities nationwide. While trauma-informed care is not explicitly mentioned in 21st Century, it is part of the, within the list of allowable uses. You do see words around supporting student success. Counseling is specifically called out. And again, while it's not in the law itself, the Department of Education and their Youth for Youth technical assistance portal and hub has a number of resources and webinars, particularly talking through how 21st Century Community Learning Center staff and practitioners and directors can utilize a trauma-informed approach in working with young people at all age levels, pre-K up through 12th grade, that the programs serve. And then at the state level, we've seen some great examples in New York, Wisconsin, and others, where, again, the trauma-informed care approach has been particularly called out for this population of young people who are working in these programs. The next one, want to talk a little bit about the Childcare Development Block Grant. So as we mentioned, these funds, in addition to the $3.5 billion that went through the CARES Act, there's about just over $5 billion in the fiscal year 2020 and now going into 2021 that primarily serves students ages 0 to 5, so infants and toddlers, but about 45% of this children that are served in CCDBG are school age. Therefore, This is another important funding stream for the youth development field and for after school field up to ages 12, 13. And trauma-informed approach has been a big part of the professional development and training that's been provided through the National Center for After School and Summer Enrichment, which is a project of the Department of Health and Human Services, Office of Childcare, and Administration on Children and Families. They've done a number of resources that you can see on the slide here that provide support, again, on the training side to staff to help staff working with students who may have been impacted by trauma and or who are feeling the effects of adverse child experiences. The next one here is one that maybe many on the call may not be familiar with. This was the Support for Patients and Communities Act. Support's an acronym. One of our, the Substance Use Disorder Prevention that promotes Opioids Recovery Act and Recovery and Treatment. This was a large landmark. A lot of people just know it as the opioid bill or law, a large piece of legislation that passed in a bipartisan manner back in October, about 2 years ago now, and still being implemented. COVID has impacted some of that implementation, but I know the font here is tiny, but lots of opportunities in here, mostly focused on recovery and treatment, but there's a big chunk of the state targeted response grants and the state opioid response grants that are focused on prevention as well, and that take a trauma-informed approach. Lots of big systems level language and initiatives within this bill that provided for things like training and support within a number of government agencies that oversee some of these programs. So the interagency task force, that's HHS, SAMHSA, part of that, a number of other agencies that have been working on better coordinating the federal government's response to be able to ensure that some of these funding streams, including some of the ones I mentioned, are informed by the research on trauma-informed care. And so we expect to see more of that soon. There's a similar legislation that we may talk about a little bit later that would back up that, that effort as well. And then on a couple others, so last slide here, just want to mention there's many other federal funding streams that can be used in this space to adopt a trauma-informed approach. But Title I Part A, Title IV Part A, the Student Support and Academic Enrichment Grant Program, that specifically talks about, in the language, talks about the need to use a trauma-informed approach. The training piece is part of that as well. A lot of that is around effective and trauma-informed practices in classroom management. There's a focus, obviously, in both Title I and Title IV on the school day, but after school and summer and youth development programs are an allowable use of many of these programs. And then on the CAPTA, or Child Abuse Prevention Treatment Act, there's community-based grants that local organizations can use, again, to work with parents and children that use a trauma-informed approach. And finally, the last two here, AmeriCorps and AmeriCorps Vista, and the Mentoring Opportunities Youth Initiative through the Department of Justice. Both of these in recent years have taken a focus and somewhat from the opioid epidemic, but also now as a result of the COVID pandemic, to focus on having positions explicitly linked to trauma-informed staff within programs. And so as an example, the position of a trauma-informed care Vista, we're seeing more in local programs funded through the Corporation for National Community Service, like at United Ways or within school districts, as a staff person, a Vista position that can focus on bringing together some of the resources that support young people. So I'm going to pause there and look forward to discussion on how federal policies and programs provide direction, momentum, support, and funding for local and state initiatives. And also the inverse, that how federal policy programs sometimes can negatively impact programs at the local level and young people, and hope to get into that more in the discussion. But for now, I'd like to turn it over to Ayana, who will talk a little bit about the state policy perspective.
Hello, everyone. My name is Ayana Melvan, and I am the Senior Project Manager for Educational Initiatives and the lead for the Rhode Island After School Network through the United Way of Rhode Island. Today, what I wanted to talk about, and thank you, Erik, for your wonderful presentation on what's going on at the federal level, is what is happening at the state level in terms of Rhode Island, in terms of how we're thinking about policy, how we're thinking about influencing policy, and what recommendations that we want to provide our legislators as they think about pushing through some legislation around trauma-informed care and restorative justice practices. So in Rhode Island, in February, there's a lot of bills that went to the House, including a bill that would allow for there to be implementation of trauma-informed practices in schools throughout the state. Due to the fact that COVID-19 hit us, the General Assembly put a lot of the legislation on pause and looking at the different items that hit the floor. So we don't have any kind of information yet on where that bill is and how it's going to be considered to be passed. But I think that I feel confident that because of what has happened during COVID-19, that we will be able to see that bill have some traction and move. And we're also waiting for after the election to see who stays and who gets voted in, that we're sponsoring these bills that have gotten kind of held up, and they're in limbo as the General Assembly kind of figures out who is going to stay and also who is going to continue the work when we come out of this. But there was a bill written that was a partisan bill that was looking at establishing that implementation during the school day. And so my after-school network has come together in so many different ways during the COVID-19 pandemic, including trying to take a look at some anti-racism policies and procedures and practices for the entire network. And so what transpired from that was 3 working groups. One is focusing on policy and practices within the actual organizations themselves. One is focusing on activities being equitable. And then we have our school to prison pipeline working group. So this is their slide that they presented. They've been doing this work since the beginning of the summer, really pulling in data at the state level of the school to prison pipeline in Rhode Island and who it's impacting. And so these are the members of that working group, all statewide folks that have gotten together to look at the data and then make recommendations. So the priorities were obviously data-informed recommendation, like I just said, continue research on evidence-based solutions, and identify the training and information needs of the programs. And so this is one of the many sections, and I wanted to focus on restorative practice because it is something that has been talked about at the legislation level already here in Rhode Island. And so they really just want to bolster and put some more fire behind this, take advantage of this moment. So restorative practice is, it really is just about improving relationships with young people and fostering a sense of community and sense of belonging, empowering students to address any type of tension in a very healthy manner, in a holistic manner as well. And so when we're talking about restorative justice practices, we're talking about, there's 3 levels, and we're talking about prevention around practices that build and affirm relationships. We're talking about having different types of conflict resolution, and so not going straight to the punishment, but rather trying to prevent any type of harm. So again, really looking at what we're doing when we're putting together our sheets on referrals of students, where they're going to go next, instead trying to have a different way that we do punishment. And then if there is harm done, having a different intervention that kind of looks at the situation with a different lens. And so this would require bringing in a lot of different folks into the picture at the programmatic level, but also at the state level. So there's 3 things that this particular group looked at, and they're looking at. That's getting the network to do a complete inventory of what after-school programs in Rhode Island are doing around restorative practice, and investigating the best practices regionally, and then comparing it nationally. And then they're also looking at doing a survey of the Ryan membership. They just put out a survey with restorative justice practices, which will look at the results. And then they're also putting out a new survey trying to figure out how our mental health specialists engage in this practice in the state. And then consider support for the Juvenile Hearing Board as a resource and an alternative in informing parents and students in the wider community, and really also looking at that Juvenile Hearing Board at the local level as well, which we'll hear more from my counterpart on the other end of this presentation. So the results from the statewide survey, 14 groups responded, elementary, middle, and high, and 13 out of the 14 offer educational programs with STEM, sports, youth development, and youth development programs were the second most commonly offered. Restorative practices, they are handled by our executive director, site coordinators, and after-school staff. But really, we saw like the top folks really handling it, especially with the connection to the school day. And then 3 organizations didn't have one specific person assigned to those practices. What we also discovered is that on a scale of 1 to 5, most organizations ranked around 3 in terms of offering and implementing restorative practices. And most organizations define restorative practices as an alternative to traditional and punitive punishment. And so they really focused on communication, trust building, a sense of belonging, which were key. And then 3 organizations didn't really have a well-defined definition. So the survey results continued are that the OST programs are working collaboratively with their school districts. So some of the school districts in Rhode Island are listed there. And the organizations identified that their best restorative practices are supporting family needs, empathy building, and community development. And so the organizations, they all have different approaches in engaging youth in restorative practices, especially centered around like peaceful conflict resolution strategies. And a lot of the programs mention things around cultural competency in that realm as well. None of the organizations are provided funding or support for restorative practices, not uncommon to what we're hearing at the national level. And organizations identified training sessions, they need more training sessions, more staff, and funding to better implement restorative practice. So the recommendations are to develop restorative practice definition for the entire field and for all the field in Rhode Island to adopt. Create a framework to support organizations in implementing restorative practices because we know that that framework could help sustain the work and make it consistent in terms of staffing leadership. Local funding, training resources to help organizations develop their restorative practices. So really what we're looking at, it says locate funding, I'm sorry, is how is the state going to reallocate dollars and put it towards after-school programs that are practicing restorative justice practices, and then develop a rubric or a tiered system to help organizations evaluate where they align with others, with other organizations in restorative practice work. So the additional areas of focus in terms of recommendation is around professional development, which was mentioned before, family engagement and education, really trying to look at the whole child, look at the whole family approach, and make sure that our families are educated on what happens with the trauma-informed care and what happens with restorative practices and why they're needed. And then, of course, funding, always trying to figure out what is there in terms of our legislation and policy that's already been passed, and if any dollars are attached that again, can be reallocated out to our OST fields. So to wrap up, really what Rhode Island is trying to accomplish is mitigating the school to prison pipeline. And we know that a lot of times this takes such a tremendous amount of work in terms of proving the impact, and then proving the impact of out-of-school time programs. And so one of the things that we know that's happening in Rhode Island is a lot of our youth development programs and our youth-led programs have been moving the needle on policy, including ARISE, which is the Alliance of Rhode Island Southeast Asians for Education. Their students worked on a movement to pass the All Students Count Act in Rhode Island, and this legislation mandated the disaggregation of of education data to better understand the educational experiences of many subgroups within the Asian American and Pacific Islander population. And once they did this, they were able to really dive deep into how these different pockets are impacted, and it identified mental health needs, including trauma-informed care. Our other youth groups like Youth in Action, Young Voices, Youth Pride Inc. have all been working with young people and with adults, so two-generational approach, moving policy to make sure that youth are heard in a different level, and that includes trauma-informed care. All these youth groups have been working together over the summer to and they've been organized. They organized the largest protest in our state with over 10,000 young people. And they've really been pushing for restorative practice to be not only folded into their school day, but also folded into the other institutions within our state. So lots of policy is going to start moving soon. And it's all because of the actions and energy that is coming off of our youth, and how they are moving, they're moving and shaking up a lot of the adults that started to think about this, but now they're actually putting policy to the conversation. So pay attention to Rhode Island as we move forward and try to get the bills that are stuck in legislation, stuck at the General Assembly level right now passed around trauma-informed care. And also I'll keep informing the Afterschool Network, the 50 statewide network, and hopefully get it out through the alliance of the great work that's happening in Rhode Island with our working group, looking at mitigating the school-to-prison pipeline, specifically around mental health, and making sure that we're understanding where we are at in Rhode Island around restorative practice. And now I'll hand it over to my colleague.
Hi, everyone. My name is Chelsea Eickert, and I work for the city of Alexandria in Virginia. I am their coordinator of a citywide children and youth master plan and the co-coordinator of our city's trauma-informed community network called RAISE. And given the limited time we have left, I want to make sure that we have time for questions, so I'll try and get through my piece quickly. This is just a slide on who I am, my background, and how I gained my expertise and passion for this work in trauma-informed care. I was born and raised in Kalispell, Montana, which is not super relevant to this webinar, other than that's where I was a young person with my own trauma. Then from there, I went to college in Seattle, Washington, where I got my bachelor's in geography. And I really loved learning about why and how place matters, that your zip code can be one of the strongest predictors of your outcomes, and how access to resources really depends on where you live. And during that time, I was a preschool teacher, and that's where I really developed a love for working with children and families and understanding the importance of how important early childhood is. And because I really wanted to broaden my horizons and take action as a young person in my community, I started community organizing for an anti-racist grassroots nonprofit in Seattle that really wanted to make the food system a more equitable system and transform policies that harm like farm workers and everyone in the food system. And then from there, I was really interested in doing more systems level work. Yes, being a childcare provider was really rewarding, but I really wanted to expand the work at the system level. So I went and got my master's in community development and planning in Worcester, Massachusetts, where I studied the barriers that high-risk families face when accessing resources. And that's when I learned about adverse childhood experiences and the lifelong impact of childhood trauma. That's where I also got to help build a community-wide plan that aimed to reduce and prevent youth gang violence. And I was on the strategy team that focused on making sure everyone is trauma-informed. How can we have a trauma-informed city? And after I graduated, I moved back to Seattle, where I worked for an anti-racist nonprofit as a children's planner, where I got to create, work with the community there to create a cradle to career, a continuum of services that supported families and the young people in their services. And when that grant ran out, I then moved out to Virginia, where I'd never been before, but the job was so amazing. It was perfect for me. In my current role at the city, I coordinate the city's Children and Youth Master Plan, which I can talk more in depth later. But it really combined my passion for early childhood and youth voice with community development. And while I've been here, I established our city's trauma-informed community network, which I'd be happy to talk more in depth later. But bringing people, our communities across different backgrounds and disciplines to address trauma, raise awareness about trauma, and train people in trauma-informed care. And then finally, I'm a member of our racial equity core team in my department, making sure that we are advancing equity at all levels of government. Next slide. So these are some policies that I thought of that help address the needs of communities, particularly children, and the intersection of early childhood trauma and outcomes with children. So I won't go over all of these given our time, but youth master plans, children's cabinets, community health improvement plans, these pick-ins, and GARE is, what they all have in common is that I think what they do is they bring stakeholders together who share a responsibility for the safety, education, and healthy development of our young people and the residents, and to give them a guide in and using these plans to inform policy decisions, make budget decisions, and to inform where we need to be making our investments. And they also offer like a vision for our future. They often assess the community's needs and the resources available to fill gaps, and really can play a key role in advancing trauma-informed policy and advancing racial equity at the local level. Next slide, please. And these are just some recommendations that I think of for what an individual can do in shaping policy. So I really encourage everyone to seek opportunities to engage in any community engagement opportunities where you can be a part of creating community-based plans like youth master plans and community health improvement plans. Don't be afraid to reach out to your local departments that serve children and youth and just ask, what initiatives are you working on that volunteers can help move forward. You can also advocate for policy changes through your local children's cabinet, or in Alexandria, it's called the Children, Youth, and Families Collaborative Commission. I know that they're also called children's councils. You can also advance policy through public health advisory boards and parent teachers associations if you are a parent. You can join a trauma-informed community network or start one like I did so that your community also has a community network coming together around trauma and healing-centered practices. You can join the Racial Truth and Reconciliation Virginia Coalition if you are a Virginia resident. That is a coalition that's promoting equity, inclusion, and justice to combat systemic racism and oppression in our city and at the local level and in our state. Any jurisdiction can become a member of DARE, the Government Alliance for Racial Equity, to advance racial equity and advance opportunities for all in their community. And finally, I know that the deadline is passed for filling out the census, but I really want people to encourage others to fill out the census and to understand why the census is so important for directing funds to communities, because it makes all the difference. That is my spiel, and we can open it up to questions.
So thank you so much, Chelsea. Thank you, Ayana. Thank you, Erik. Thank you, Hal. We absolutely want to get to your questions. I know we're a little tight on time, but I encourage you all to use the question box. So type your questions there. I'm going to kick it off with one, and I know Hal will too, and then we'll turn it over to all of you. Otherwise, we have a plethora of questions we can ask. I want to follow up on, Chelsea, thank you so much for showing us all the ways we can advocate at the local level. I think that's really important. Erik, I was hoping you could give us a few ideas of how we as stakeholders can advocate to get more resources and policies at the federal and state level so that we can really bring these practices to life at the local level.
Yeah, I can kick it off at the federal level. I think a lot of the practices are the same at state, local, and federal. All levels are important to really direct resources. It's harder, I think, now in a virtual environment, but things like site visits can still happen virtually, but where they're possible to happen in person, that's always better, or when eventually that's able to happen again. But having policymakers and or their staff are just as important, come out to programs and really see what, particularly a concept like a trauma-informed approach or trauma-informed care at the local level. And some of these concepts can be a little bit abstract. So seeing what it looks like in a program, seeing social emotional supports in practice at a program, having young people be able to talk to those staff and policymakers and the youth voice, which is so important, and having staff and parents as well to be able to explain what the funding is used for, why it's important, why you can only reach so many students, or what the limitations of the current funding are, and being able to really bring it to life. So it's not just words on a page in someone's office in DC or at a state house, at the state capitol, or at the mayor's, at the local government. So I think the site visit piece is important, looking for opportunities like virtual town halls in this environment, obviously picking up the phone or Zoom meetings, phone calls, emails. Advocacy is still going on in 2020 in a big way, particularly informing the dollars and fingers crossed the next CARES COVID-19 relief bill that hopefully we'll see maybe in November. But everyone has a responsibility to advocate on that, on other issues, and to really explain and show how the funding, how and why it's important, and be able to convey that. So I'd start there and welcome Chelsea and Ayana to weigh in on that question too.
So at a state level, to kind of move this, I agree with Erik about inviting folks to come into your, whether it's digital platform, hybrid platform, to see what's going on. I think it's crucial during COVID-19 to do that, to show them, hey, we still exist and we're still moving forward and this is what we're doing. I think also at the state level, it's great to bring new stakeholders to the table that you normally don't necessarily have in your circles and get them involved in the conversation around what's happening. And so I think I saw in the chat different folks to engage around this conversation. And I think that it's really important to point out that it is on the mind of our elected officials about trauma-informed care, mental health needs, especially because folks are feeling isolated right now. So I think it's a great opportunity to reach out to different folks that you might not have reached out into the past, to get them to be your champions in this work and say, hey, our out-of-school time program, our after-school program is having an impact on families and young people during COVID-19 to mitigate that stress and to mitigate the trauma that they're having.
All right. So, Ayana, you have spoken, and Chelsea as well, about involving different kinds of stakeholders in this conversation and in this work. Can you speak a little bit about how else we might engage young people to be co-leaders of this work, to advance their agency, and maybe some examples from Rhode Island?
Sure. So one of the things that we did in Rhode Island was have a youth town hall series. It was a 3-part series, and young people came together and planned out, you know, the logistics of it, planned out the platform, and then they came on and talked a lot about mental health needs. And so that process was interesting because really it was about trusting, providing trusting spaces virtually and getting youth to kind of call in and be like, who are you at the state level and what am I about to tell you? And so really creating opportunities for us all to grow together and learn together was what it was all about. So just using a lot of the things that we already know in our field to make youth feel comfortable enough to share. So one of the other things that we did was put out a survey to all youth, a statewide survey, and ask them how they're feeling during these times. And at the end of the survey, we allowed them an opportunity to say that they would like to participate. So that gave them some ways to flesh out how they're feeling, and then a little bolster on, oh, you know what, I could do this. I could talk about this out loud. So that was that piece in terms of engaging youth. In Rhode Island, all over what's happening is already there were in place youth-led organizations. And so these youth-led organizations use several different practices to empower young people and give them space and place to raise their voices and raise their ideas. And so that just continued during COVID-19. And a lot of these places try to do wraparound services so that the youth feel supported in others in other capacities. So if that young person is having transportation issues or housing issues, these organizations have been great at looking at the whole need of the child to make sure that they are able to feel empowered because those things are covered. And so there's a lot of work at the state level being done in terms of trying to think about, okay, how do we provide provide for the needs that the youth have in order for them to have space to advocate for themselves. And then how do we step back and have a facilitation process where we're not leading or dictating, we're more working alongside of them and treating them as colleagues. So that's been happening a lot here in Rhode Island, and there's plenty of great examples. So I want to point everybody to Youth in Action. If you go on their website and check out what they've been doing, they've really been empowering youth on many different levels and letting them have their voices be heard, especially during this time around racism and education equity.
I'd love to speak to that too from Alexandria. So we've spent the last 1.5 years developing or updating our youth master plan for the next 5 years. And this plan is really what I think of as it's creating the conditions for all children and youth to thrive. And so we engaged young people in the development process, and hopefully they'll continue through the implementation phase too. Through partnering with US government classes and civics classes, because all students have to take civics here in 8th grade, and then all students have to take US government and in 12th grade. And so I, at the generosity of their teachers, coordinated workshops where we went into all these classrooms and engage adults. We also went into like any community meeting, meeting people where they are and asking, can we take an hour of your time to engage you in a workshop that really creates this vision that we want for our community's future, and then help us come up with the solutions. So we did that 89 times, and we engaged almost 2,000 young people. And the result is a plan that's really centered around, we call it decrease ACEs, increase assets. So all strategies are trauma informed, and they really center equity, making sure that we are meeting the needs of children and youth and making sure that there's no barrier that stands in their way of success. And when the pandemic forced us all to stay home, we started meeting virtually every week. And we've gotten students to volunteer and take field trips to our work group meetings, and they are now work group members, and they committed to participating in action planning every week on all these issues that they care about. And so it's going to be the best youth master plan ever to grace America. And I'm just so excited about our future here because of youth voice and centering them and elevating their voice.
Great.
Well, thank you both. I wanted to just flag for all of you too that so much of what we're talking about for advocacy is not lobbying. So if you are not allowed to lobby, telling your policymakers at any level about what's happening in your programs, about the kinds of activities, whether it's a virtual site visit, whether it's a student reporting, whether it's highlighting some of these student voices or activities going on, that is not lobbying at all. Lobbying is when you're actually asking them to give money to something. And I can do that for you if you can't. But I wanted to absolutely flag that. I don't know, Hal, did you want to say something?
No, not necessarily about that, but I think that's a great point to make, the difference between kind of advocacy, lobbying. I'd like to ask all of the panelists, though, part of what we're talking about is a change in language, right? A change in framework that everyone has to adopt, not just practitioners, policymakers, your stakeholders, philanthropy, government. Can you speak a little bit about the ways in which you help people understand what is meant by the concepts and what isn't, right? That we aren't talking about helping broken children and adopting a deficit model, but we're talking about helping all young people be successful by this approach. But what advice would you give for those people who are living in communities that maybe haven't adopted this language or thinking yet? How do you go about that, and what kinds of tools and resources would be helpful in getting more people on board to use this language and adopt these kinds of approaches?
I'll start. We in the city of Alexandria are all going through racial equity trainings right now, and one of the components of anti-racism is thinking about things through the lens of taking a groundwater approach and not blaming the individual, but taking a deeper look at the entire system or the water or the lake that fish are swimming in, and asking, well, what's causing this lake that these individual fish are swimming in to create terrible conditions where they're dying? Why are the fish dying? And then, normally the questioning goes down to racism and oppression, and that's how you can use data to inform, decision making in how can we make our systems more equitable. I like to just reframe the problem so that we're not blaming the individual, that the individual is not failing, but that the system is failing that individual. And so how can we change, what are the things we need to shift to remove the problem? So that could be policy, it could be practices, it could be funding, power dynamics, mindsets, any one of those things. But it's just that tweak in our language and thinking that it's the systems that need to do better, not the individuals. The children are ready. We don't need to look at kindergarten readiness. Are kindergartners ready? But are kindergartens classrooms ready for those children?
Does anyone else want to add?
I was going to say, go ahead, Erik, but I was just going to kind of build off of that. One of the things that I think is important as well is that data collection. Here in Rhode Island, we heavily use the Rhode Island Kids Count Fact Book to help as Chelsea mentioned, reframe the message and talk to the different stakeholders, making sure that it appeals to them around this conversation. And one of the things that, we know is that here in Rhode Island, we look a lot at the social determinants of health. And so this directly impacts our students at that level. And so we know that poverty, racism, and discrimination are linked to toxic stress and have adverse side effects on brain development. And we're trying to figure out, okay, how, and we know how it impacts them later on in life in terms of health. So we can focus a lot on the health disparities that are happening with our young people and where programs are placed in terms of placemaking. So I recommend other states to look at where the programs are housed on a map, who are they serving, and what health disparities are happening in those different pockets to help form your message when you're talking to the different stakeholders and you're advocating.
Thank you.
I can chime in really briefly. I'll just say on the federal level, I think it is a challenge in the language that's used and talking about some of these concepts with staff and federal policymakers. A lot of that shifted and changed actually last year when unfortunately the late now chairman of the House Oversight Committee, Elijah Cummings from Maryland, had a long, prior to his passing, had a long series of hearings of the committee around trauma-informed care and approach, and really got his colleagues on both sides of the aisle and staff and a number of allied and stakeholder organizations informed about what the terms are and what the approach is, and really looking from a macro level all the way down to a micro level to practices that could be changed in the House of Representatives and within this committee, and ways that staff are treated and language that people are using. And a lot of that has translated into legislation, some of which that is passed, but others that is pending, like the Rise Up from Trauma Act, that really provides tools for, at the federal level, agencies who are overseeing some of the grants that go to state and local level, everything from, again, from AmeriCorps to a lot of the programs within the Department of Health and Human Services, to use that trauma-informed approach and lens for a wide range of programs that right now, again, are taking that less of an asset-based approach and trying to flip the script on that. Still a long way to go, but a lot of groundwork being laid.
So before we wrap up, I want to get to the question in the question box, which is specific to rural communities. Do we know of any resources? I know a lot of resources are mentioned here and can be used by anyone, but that might be specifically helpful to programs in rural America. And if it's a blank, we will get back to you, because we know that there are there's some states out there. I know Wyoming's done some really tremendous things around juvenile justice. So we'll make sure to get back to you on that.
And I have a quick something that we've done and something that I've worked with in rural areas is reaching out to the colleges and universities. A lot of them have either somebody that's focusing on this or a department that's focusing on this, and you could even probably I've been getting policy briefings from my higher education institutes. So it's just another, if you haven't, avenue that you could use.
In Virginia, there are rural trauma-informed community networks. These networks can be developed by anybody, and it's really about just bringing people together. It could be virtually, which would work best if you are living in a rural setting, to figure out ways to advance trauma-informed policy at the program level up to like the state level.
Terrific. Well, I will do the penultimate close and just thank you all, and thank you for the wonderful commentary in the chat room. I think that, we have an extraordinary group of panelists with tons of information, and then we have an extraordinary group of stakeholders that are on this. So we will be sharing all that information with you. We'll be sending it to you so you don't need to take notes. I thank you all for your time and your expertise. And I'm going to turn it over to Hal to close us out.
Thank you very much, Jodi, and thank you, everyone. This was a really rich discussion. I think the distinctions between advocacy, lobbying, engagement, informing are really important. And I think there are enough policies out there that we can modify, that we can ask for blended approaches, braided funding approaches, that we don't need to completely invent a new way of working. We need to think about working more flexibly, more innovatively, in a more engaging way, including stakeholders like young people themselves. But this is all really important work, and I'm so glad to see the policy discussion as a part of this, not just focusing on research and practice, as important as they are. We always want to also understand what the policy lens might also afford us in this work. So thank everyone, and particularly thank the panelists and Jodi for joining us this afternoon.
And I know that I'm leaving inspired. I hope you are too, because and I know you said this in the chat room, some of you, like, as horrible as COVID is, we're going to turn it into an opportunity and use everything we're learning to do more for our kids.
Absolutely. So thank you all, and enjoy the rest of your afternoon.